Demonstration of SafeAcune blood glucose monitoring system. SafeAcune blood glucose monitoring system is easy to operate, convenient and speedy. It can be applied to medical organizations and patients with diabetes mellitus. Here is the SINOCARE certified diabetes educator with demonstration on how to use a glucose meter and strips. Wash your hands, rinse and dry completely. Warm your fingers to increase blood flow. Screw off the cap of the lancing device. Insert a lancet into the lancet holder and push down until it's fully seated. Note that the lancet is for one-time use. Only twist off the protected cap until it separates from the lancet. Replace the lancing device cap and set the puncture depth to the desired number. Pull back the cocking control until it makes a click, and then release. Now the lancing device is ready to use. Remove a new test strip within the valid expiration from vial. After taking the strip, immediately cover the vial. To avoid losing efficiency, insert test strip into the strip slot. The test strip is suggested to use up within 3 minutes. The meter turns on automatically. When the blood symbol starts blinking, the meter is ready to use. Use a 75% cotton ball with alcohol at the blood sample site for disinfection. Be careful not to use iodine or disinfectant containing iodine disinfectant. Once the alcohol has evaporated cleanly, align the prepared puncture device with the disinfected skin and press the button to collect the blood. Use a tube to resist the lower part of the puncture device to help the blood draw. To obtain best accurate results, wipe off the first drop of blood and squeeze another. Apply the blood sample to the opening of the absorption channel of the test strip until the confirmation window is fully covered with blood. The meter will display your blood glucose value after several seconds. Push the strip ejector to eject the test strip automatically. Twist off the lancets. Cover its cap and place it properly according to medical waste management regulations. Now let's review the 2 steps again. Prepare equipment. Install lancet. Insert strip and set the device. Disinfect and obtain blood sample. Apply the blood sample. Strip ejection automatically.